Ever wondered what the first signs of cancer might look like? Today, we're going to explore this vital topic that could potentially save lives. We'll be delving into the 10 early signs of cancer that you just can't afford to ignore. If you're tuning in for the first time, remember to hit that subscribe button and the bell icon so you don't miss out on crucial health tips like these. Understanding these early indicators is of paramount importance because detecting cancer in its initial stages significantly boosts the chances of successful treatment. So let's arm ourselves with knowledge and adopt a proactive approach to our health. Remember, it's essential to consult with a healthcare professional for an accurate evaluation and diagnosis. Now let's get into the details. Knowledge is power, after all. The first sign we're going to discuss is unexplained weight loss. Picture this. You're dropping pounds at an alarming rate without any significant changes to your diet or physical activity. It's natural to feel a sense of achievement, but before you celebrate, pause and consider. This sudden and unexplained weight loss could be a potential sign of various cancers. Cancers such as pancreatic, stomach, esophageal, or lung cancer often cause this unexpected weight loss. The weight loss happens because cancer cells use up your body's energy supply, and your immune system uses energy to attempt to fight off the disease. So if you find yourself reaching for smaller-sized clothes without trying, it's time to check in with a healthcare professional. It may not be cancer, but it's essential to rule it out. Always pay attention to changes in your body, especially when they seem sudden and unexplained. Second on our list is persistent fatigue. We're not talking about the kind of tiredness that comes from a long day of work or a sleepless night. This is about an extreme, constant sense of exhaustion that doesn't improve with rest. It's the body's way of telling us that something isn't right. You see, our bodies require energy to function properly. When cells are healthy and doing their jobs, we feel energized and ready to take on the day. But when our bodies are fighting off diseases like cancer, it can deplete our energy reserves, leading to persistent fatigue. This lingering tiredness can be a symptom of several types of cancer, including leukemia, colon or stomach cancer, and many others. It's crucial to take note if you're experiencing fatigue that's out of the ordinary for you and if it's affecting your daily life. Remember, your body needs energy to fight off diseases. Don't ignore persistent fatigue. Next, we'll be talking about changes in the skin. Your skin is an incredible multi-layered organ that serves as the front line of your body's defense system. However, it can also be the canvas upon which early signs of certain cancers, such as skin cancer, begin to paint an unwanted picture. Pay close attention to alterations in the size, shape, color, or thickness of any moles you may have. These changes could signal the onset of melanoma, the most dangerous form of skin cancer. Also, be on the lookout for the sudden appearance of new skin lesions. They could be benign, or they could be indicative of non-melanoma skin cancers like basal cell carcinoma or squamous cell carcinoma. Remember, early detection offers the best chance for effective treatment. Your skin is your body's largest organ. Keep an eye on it. Now let's discuss persistent cough or hoarseness. This sign might seem like a common symptom of a cold or flu, but if it lingers for more than a few weeks, it could indicate something more serious, such as lung cancer. You see, our body has a clever way of alerting us when something is off. When a cough or hoarseness persists, it's your body's way of saying, hey, something's not quite right here. It's especially important to pay attention if your persistent cough or hoarseness is accompanied by other respiratory symptoms. These might include difficulty breathing, chest pain, wheezing, or coughing up blood. Lung cancer often starts in the bronchi, the tubes that carry air to the lungs, but it can also begin in other areas of the lungs. It's a condition that can affect anyone, regardless of whether they've smoked or not. Always remember, never dismiss a persistent cough or hoarseness. Fifth on our list is changes in bowel or bladder habits. It's not something we often discuss, but these can be indicative of certain types of cancer. It's important to pay attention to your body's waste elimination process, as it can tell you a lot about your health. Significant and unexplained changes, such as blood in the stool or urine, consistent constipation or diarrhea, or a change in the size, shape, or color of your stool, could be a warning sign. These symptoms can be indicative of colorectal, bladder, or prostate cancer. However, keep in mind that these changes could also be due to non-cancerous conditions like infections or certain food intolerances. So don't panic, but do take these changes seriously. Always consult with a healthcare professional if you notice any persistent changes. Remember, catching any potential issues early increases the likelihood of successful treatment. Your body's waste elimination process can tell you a lot about your health. Next up is difficulty swallowing. This can be a common inconvenience for many of us from time to time, but if you're finding it persistently difficult or painful to swallow, it's worth paying attention to. This discomfort could potentially be a sign of esophageal or throat cancer. Esophageal cancer often starts in the cells that line the inside of the esophagus, the long, hollow tube that carries food from your throat to your stomach. Throat cancer, on the other hand, can occur in the voice box, tonsils, or the oropharynx, the middle part of the throat. One of the early symptoms of these types of cancer is dysphagia, a medical term for difficulty swallowing. This can feel like food is stuck in your throat or chest, or even cause you to choke on your food. Remember, it's crucial not to ignore these signs and always consult with a healthcare professional if you experience persistent difficulty swallowing. Another sign to look out for is unexplained pain. This isn't your everyday aches and strains that result from physical exertion or minor injuries. We're talking about continuous pain that persists, even with typical treatments and rest. This type of unexplained pain, depending on its location, could potentially be a symptom of various cancers. For instance, persistent headaches could signal brain cancer, while ongoing back pain might suggest something like colon or ovarian cancer. Remember, pain is an important communication tool for our bodies. It's a way for your body to tell you that something isn't quite right. It's crucial not to dismiss this pain, especially if it's persistent and unexplained. Always consult a healthcare professional if you're experiencing such pain. Pain is your body's way of telling you something is wrong. Don't ignore it. Ninth on our list is changes in breast tissue. This sign is particularly important for women, but men should also be aware, as breast cancer can affect them too. The breast tissue is made up of milk-producing glands, ducts that carry milk to the nipples, and fatty and connective tissue. When these tissues undergo changes, it could be an early indication of breast cancer. Changes may include the development of a lump or thickening in the breast or underarm that persists beyond your menstrual cycle. Other changes to look out for are dimpling anywhere on the breast, unexplained swelling or shrinking, especially if it's only on one side, and any changes in the size, shape, or position of the nipple. Even a slight change in the look or feel of the skin, like becoming red, scaly, or puckered, can be a signal. Remember, these signs don't conclusively mean you have cancer, but they warrant a check with your doctor. Early detection is key in the fight against breast cancer. Finally, we have irregular bleeding and persistent indigestion. Irregular bleeding is a symptom that should never be overlooked. It may manifest as bleeding between periods or after menopause. This can potentially signal various types of cancer, including uterine or cervical cancer. It's important to bring any such changes in your body to your healthcare provider's attention as soon as possible. Next, we have persistent indigestion or an upset stomach. If you're experiencing chronic indigestion, stomach discomfort, or a persistent upset stomach that doesn't improve with usual treatments, it could be a cause for concern. These symptoms may be associated with stomach or esophageal cancers. Again, seeking the advice of a healthcare professional is key when these symptoms persist. In the end, the most crucial takeaway is this: never dismiss irregular bleeding or persistent indigestion. These symptoms, while common, can sometimes be an early sign of something more serious. Your body is always communicating with you. It's important to listen and act accordingly. And there you have it, the 10 early signs of cancer you can't afford to ignore. Recognizing these signs is a critical step in early detection and increases the chances of successful treatment. From unexplained weight loss and persistent fatigue to changes in the skin, persistent cough, altered bowel or bladder habits, difficulty swallowing, unexplained pain, changes in breast tissue, irregular bleeding, and persistent indigestion. These signs should not be overlooked. If you or your loved ones experience any of these symptoms, it's crucial to consult with a healthcare professional for proper evaluation and diagnosis. It's all about being proactive and taking charge of your health. Share this video with your loved ones to spread the word. Let's empower each other with knowledge and prioritize our well-being. Remember, knowledge is power. Stay healthy and we'll see you in the next video.